This presentation is on your antiviral agents, and I believe should go with chapter 10 in your Karsh textbook. So chapter 10 from the Karsh textbook, antiviral agents. So viruses that will respond to antiviral therapy include influenza A and some of your respiratory viruses, herpes viruses, cytomegalovirus or CMV, HIV, which causes acquired immune deficiency syndrome or AIDS, hepatitis B and C, and also some of the viruses that cause warts and certain eye infections. Characteristics of common viruses. Viruses cannot replicate on its own, so it must attach to and enter a host cell. And so once it enters that host cell, it's going to use the host's energy to do all the processes that it needs, synthesizing protein and DNA and RNA. They're very difficult to kill because they live inside our own cells, which are their host. So any drug that kills a virus is also going to kill those host cells, which are our cells. So this shows you the stages of virus replication. So you can see the virus adheres to the cell surface. It's going to then enter that host cell. The virus sheds its coat. It begins the replication of viral nucleic acids, synthesizing proteins, and then producing more virons or more virus that then get released out to the body and then are going to go to more host cells and infect them. Characteristics of antiviral drugs. So antivirals are going to have to be able to enter the cells that are infected with the virus. They are going to interfere with viral nucleic acid synthesis and or the regulation of that synthesis. Some of the antiviral agents are going to be able to interfere with the ability of the virus to bind to cells, and some of the agents stimulate our own body's immune system. The common respiratory viruses that we would use antiviral medications with would include influenza A, B, as well as RSV, which we'll talk about a little bit more with our presentation and our module for infection during your day 2 lecture time. Signs and symptoms of respiratory viruses would include things such as cough, fever, inflammation of nasal mucosa, and inflammation of the mucosa of the respiratory tract. Antivirals across the lifespan. So this is a box that is in your Karsh textbook, and it does talk about children, adults, and your older adults. So for example, under children, it talks about how children are going to be very sensitive to the effects of most antivirals. That a lot of the antivirals do not have proven safety in children and should be used very cautiously. Acyclovir is the drug of choice for children with herpes virus or CMV infections. Under adult, it does talk about use of antibiotics related to viruses. You know, that you have a lot of adults who are really not aware of the differences between a bacterial infection and a viral infection and are requesting antibiotics, and that's increasing resistant infections, but it's not going to treat the viral infections. Here it also discusses like with pregnant women, for example, that they should not use antivirals unless the benefit clearly outweighs the risk factors. Zidovudine I'm not sure that I said that correctly, but that has been safely used in pregnant women. And of course, we know with our older adults that they are more susceptible to having more adverse effects. And, if they have liver issues or kidney issues, then we would need to use extreme caution. They should have the antivirals in a much lower dose and should be monitored much more frequently. So, taking a look at several specific drugs used to treat viral infections, acyclovir would be one, and it is used for initial or recurrent herpes simplex virus, chronic suppressive therapy, herpes zoster, varicella, and varicella zoster. It does have adverse effects such as headache, nausea, vomiting, neuropathy, and kidney dysfunction. And there are drug to drug interactions with other nephrotoxic drugs such as aminoglycosides. Nursing implication or patient education, much similar to what we have discussed in previous presentations. We need to know the baseline for our patient. We need to know what their immune system status is, as well as their current vital signs and other baseline information that we have on our patients. So, to make sure that we have something to compare to later on. Also, we do want to teach about the medication that they're on, signs and symptoms that they should report, as well as, how to take their medications, how to do that appropriately and safely, and to be aware that a antiviral medication is for viruses. Antibacterial medications are for bacteria, and so that patients know the difference between that, so that they're aware of what they're being treated for, and how that we're going to be monitoring them through their therapy, and that their medications are being prescribed appropriately. I was just going to look at a couple of other things here that you might want to think about with patient teaching. So if we're receiving or our patient is receiving antiviral therapy, we do want baseline assessments, as we said. But we also want to make sure that we're continuing those assessments throughout their treatment, and that we're minimizing adverse effects. So we're monitoring their lab work, such as their hepatic and their renal function, culture, CBCs, looking for signs and symptoms of issues throughout their therapy. Another antiviral medication that we want to look at is ganciclovir or cytovine, which is used to prevent or to treat CMV retinitis. Signs and symptoms of CMV. It can be asymptomatic. It can also cause fatigue, nausea, jaundice. And if this is contracted during pregnancy, it can result in stillbirth, brain damage, or birth defects associated with the fetus. So, with this medication that we're using to treat CMV, there are some adverse effects that we would be looking for in particular. Blood dyscrasias, seizures, nephrotoxicity, neuropathy, and hepatotoxicity. Um, we would not give this medication if they have allergies to antiviral agents. It is highly toxic in pregnancy and lactation and in the presence of renal disease. We wouldn't want to give this and it being I can't say that, sorry, nephrotoxic along with other nephrotoxic medications. So that would be a bad drug interaction like aminoglycosides and these antivirals to treat things like the CMV. So nursing implications and patient education. So again, we want to know, their history of allergies related to antivirals, what's their current physical status, and we're going to continue assessments throughout their therapy, but we want a baseline assessment to start off with. We want to evaluate their skin, their temperature, any possible skin lesions, renal functioning, anything associated with that, would tell us about information related to possible adverse effects, lab values, making sure our patients know what to report to us as possible side effects. So here, this just kind of shows you your symptoms of influenza that we also can use antivirals to help treat. Of course, hopefully folks have gotten a vaccine annually, usually between October and March. Here's your symptoms of influenza. And we possibly could treat that with Tamiflu. And it will also help to treat the avian and the swine version of that. It does have adverse effects like nausea, vomiting, bronchitis, insomnia, vertigo, and it can cause self-injury and delirium in children. Someone taking Tamiflu, we would want to know again about allergies, liver or kidney dysfunction, pregnancy or lactation status, a physical assessment baseline, orientation, vital signs, and lung sounds related to what it is that we're treating them for. In your CARS textbook, you also have the prototype listed of your respiratory antiviral agents, and that is Ramatadine, which is prophylaxis and treatment of illness caused by influenza A in adults and in children as an oral medication. And you can see adverse effects include things like lightheadedness, dizziness, insomnia, nausea, dyspnea, so shortness of breath, orthostatic hypotension, which is where we stand our patient up and their blood pressure falls when they stand or when they change positions, and depression.